Thank you. Let's see. I have a couple of comments in the role as discussant, but before I do that, I just wanted to loop back yesterday. Because we are a government organization, finding things on our website at the Office of Patient-Centered Care is not easy. So if you just Google Whole Health Library, you will find our education resources. And then if you want our website overall, the easiest thing, Google Health for Life VA, and then it will come up right away. If you go out there searching for Office of Patient-Centered Care and Cultural Transformation, Veterans Health, it'll be very harder to find. So that's just a follow-up from yesterday. Thank you again for the opportunity to share on this subject. I was really excited to hear about those examples, and I had sort of one takeaway from hearing about the programs and then like a little challenge for you guys. The takeaway is how great is it that everybody starts with the patient when you talk about interprofessional training and instituting collaborative care, and how critical is that? And so I noted that, all of these talk about starting with the patient. The first day of the course in Toronto, the patient comes in and talks, et cetera. And I think when we did the HRSA-funded project that I mentioned yesterday, and we did those shared competencies across the professions, and I mentioned yesterday how amazingly easy it was. And part of why it was so easy is we realized right away that every one of those professions was about putting the patient first. And once you put that out there, it wasn't hard to do the rest as far as what were the competencies. So that was just something nice to hear. The challenge is the last two programs, the one in Arizona and in Canada, I didn't hear you guys talk about the integrative health professions as part of the team. So what about partnering with an acupuncture school or a naturopathic school or a chiropractic school and giving those guys the opportunity to come in and be part of those interprofessional programs? And they're desperate for it. They're looking for externships. And I think in particular it's a win-win, because one thing we haven't mentioned so far, which I think is an important new piece of the landscape, is the Joint Commission mandate from January of this year, which mandates that healthcare organizations offer non-pharmacological approaches to pain. And although the standard doesn't say which exact ones, when you look at the guidance that comes with the standard that Joint Commission has put out, it specifically delineates acupuncture, massage, spinal manipulation. And so our students are going to be entering hospital environments where their hospital CEOs are bringing in some of these professionals because they don't want to get dinged on Joint Commission exams or accreditation visits. And so I think we owe it to them to bring them into the interprofessional collaborative learning environment. So just a challenge. I know it's not as easy as I made it sound. So then I just wanted to give two quick examples of places we've done this in my experience, because I think the other thing that's really important about moving from learning to practice is just having students from the different health professions meet each other, and particularly meet each other in the patient setting. So one is a project that Bo Anderson, who's in the front row here, and I did together with Albert Einstein Medical School and Pacific College of Oriental Medicine, where we built a student exchange. So Bo would send acupuncture students to work in the anatomy lab with the medical students, and the medical students could kind of show them some stuff. And then the medical students would get to go and be in the clinic with the acupuncture students, watching what they do with patients. And I think just the experience of meeting people across those divides is a really valuable, kind of important learning experience. So just creating opportunities for people to meet. And then I wanted to share one other. Can I have like 1 extra minute? I know, but I only have 1 minute left, and I have two things to say. Okay, so one other example I wanted to share is at Beth Israel in New York, we had for a long time an Acupuncture Fellowship, which was run by Arya Nielsen, and this specifically aimed to train graduated acupuncturists, already licensed acupuncturists, for how to work in the inpatient hospital setting, kind of in preparation for the Joint Commission changes. And what was interesting, so every year for about 5 years, we had anywhere from 2 to 6 acupuncture fellows who were working in the hospital. And the most interesting thing, a lot of interesting things, we actually did a qualitative evaluation of the program, interviewing the acupuncturists and the physicians and nurses on the hospital side. And the acupuncturists, of course, found it challenging. They felt like outsiders. They didn't know enough about how the hospital worked, although they learned over time. So that was thing number one, was let's teach more about conventional healthcare settings in some of the integrative health schools. The second thing was that the physicians and nurses didn't really care about learning the Chinese medicine paradigm. They didn't care about why it worked. They just cared about the experience their patient had. And once they saw their patient benefit, they didn't care if they didn't know how it worked. They didn't care about knowing about the studies. They were calling the acupuncturist. So I think that's another sort of argument for getting people into the clinical setting so they can see the impact that everybody's work has on the patient. But flip side of that, I think the complementary integrative health professions and some of the other allied health professions as well, another big barrier is the ability to have real research literacy so that when the conversation comes up with the physicians, and this goes back to that power dynamic I mentioned yesterday, they feel competent, they feel comfortable. And so another part of Beau's work, and this is happening in many of the health profession schools now, is figuring out how to reach the basic level of research literacy so that the conversation can happen between the professions. And I think that's another really important part of moving from education into collaborative practice. I could just keep talking. The last thing I want to say is VA has some great examples of this happening, and Tony's going to talk later, but I wanted to mention one. Can I have 30 more seconds? 30. Okay. So there's a great program called the Empower Veterans Program. I'm happy to share more information. Michael Sanger in Atlanta has started this. It's a 10-week program for high-impact chronic pain, veterans with high-impact chronic pain. It brings together social work, chaplaincy, physical therapy, and teachers of mindfulness. And they meet once weekly for 3 hours a week for 10 weeks, and they're having some great outcomes. Started in Atlanta, it's now in 5 or 6 VAs, and they're measuring some really good pain outcomes, including decreased opioid use and decreased suicidal thinking. So lots of great examples in VA where we're looking at these things as they move out into practice. Okay, thank you. Sorry to steal 2 more minutes.
Great. Very informative.